Okay, the doctor sent you here for your SI joint problem that you're having. We've taken some extra classes on this, and there was a large class in Las Vegas that we went to with the World Back Symposium. And these people were all specialists from around the world, big surgeons, neurosurgeons, orthopedic surgeons, chiropractors. Even there was a physical therapist, McKinsey, that a lot of people are still doing their exercises to this day. The big thing that we've got away from this is not just the big names that were there and giving us these little spiels. It was that they had a clinic that was going on for a month, and everybody would bring in their x-rays, MRIs of their problems that they had with the back. And within the month, there was almost 1,000 people that had gone through this. And out of the 1,000 people, 85% had SI joint problems. Now, that doesn't mean that they didn't have their bulging discs, their herniated discs, their compression fractures, stenosis, and all the other multiple back problems. But one of their main components that was producing pain was from their SI joint. Now, the SI joint, well, you know where your pain is, but actually the location is between the sacrum, which is the triangular bone, and the ilium, the big side of the pelvic bone. These two bones together make a complex to where it makes part of pretty much the whole pelvis. Now, the rotation that you're having on your right side, you're rotated back on this ilium bone. And when it rotates backwards, it pinches on the sacrum. So the SI joint dysfunction is actually a locked bone. Now, most things in the body, your shoulder, your hip, your knee, all have very smooth surfaces. But when it comes to the SI joint, the ilium here is half of it, and this is so irregular of a surface that when it rotates back and locks, you have a lot of sharp pain from it. And the funny thing that happens is, it's just that the pain can be varied in a lot of different locations. So pinpointing the pain in this area is common. People also get a groin pain sometimes with it. They'll have a burning and aching in the top and side of their thigh, as well as some numbness, and occasionally will actually radiate down into the side of the ankle. Now, part of the problem why it's going down the leg, and it's not actually a nerve itself that's getting pinched directly, when this rotates backwards, the piriformis muscle that's in the center of this pelvis is pushed backwards on the femoral nerve. So when you hit the femoral nerve from here, it goes down just like you have it being pinched. So that's why you're having some radiating pain with this. Now, to relieve the problem, we have to try to do is unlock it. Now, it's really easy to unlock. In fact, we'll show you ways you can do it at home. The problem being is you got to heat the area first because this has been locked a while. So it's a much easier type of mobilization that can occur. As well as that, we'll show somebody from home how to be able to do that as well. The thing that goes along that a lot of people treat, but it's the quick manipulation, it'll come back and lock up on you. The inherent problem is that the body thinks you actually broke your butt. The bone rotating backwards and pinching, it's not in the right place. So the paraspinal muscles go all into spasm to try to support, just like a fracture would be. So until you get this muscle belly, or this long one that runs along the whole spine, to relax, it's going to keep locking up on you. As well as getting the piriformis muscle to relax so this can move backwards as well. Otherwise, we can adjust it now, and you step wrong getting in your car and it's locked up again. We also will do some exercises. Now, the main one for this problem is actually, they call it the core exercises. But to get precise, there's not a muscle that actually goes directly to your SI joint. They all attach to ligaments that then attach to the joint. So it's an indirect type of connection to stabilize the SI joint. What we're going to do is tighten the stomach muscles. That's the most prominent way, and if you can do that throughout most of the day when you're up and moving, you're getting in and out of your car, you're bending over to pick something up, just by pulling in the belly button. That's all you need to do. Will stop this from rotating backwards and locking up on you again. Okay, let's go see, and I'll show you how you're locked up right now. So we'll have you lay on your back. Okay, we're going to check to see if the SI joint now is locked up. Let's go ahead and bend your knees up. Go ahead and raise your bottom up. Okay, down. Now straighten the legs out again. Now, Normally, if one of the ilium bones is rotated backwards, that leg will also be pulled up and make that leg look shorter. And on yours, it definitely is. You're about a ½ inch shorter on this side. Now, in case there was some type of fractures that shortened your leg, or if you had a total knee and you never were able to lock the knee straight again, the only other place that would make a big difference is that we need to check up in front of the pelvis. And in fact, we're going to look at these two ridges that are on the front right here, and they should line up. Okay, so we're looking at, okay, here's what they call the anterior superior spine, and the two little indentures, where this side is higher up than this side. And this side usually is a lot more tender. Okay, we're going to do an adjustment. We'll do the easiest one that doesn't really require any type of hard popping. Just go ahead and we'll go from this side for that. The sacrum is what we're going to try to move. And what I'm going to have your help just to try to hold the bone in together. And we'll have you move to the side of the table here. Okay, we'll have you bend your knees up a little. Okay, what I want you to do, the two big bones that are on the outside, I'm just going to have you pull up and in, and that gaps it in the back so I can move the sacrum up and down just with one hand. Okay, raise up. Okay, come on down to my hand. Okay, and I'm just going to move it, rotate it up and down. Okay, raise up again. Okay, I'll go ahead and straighten the legs out. And I'm going to pull to take the slack out. Okay, and now you're straight across. So just that little bit unlocked the pelvis. So the things that we're going to have to do now, we'll go ahead and go through the exercises that are required. And by doing those at home and stabilizing the pelvis with the core exercises, I think everything will come out okay.